Good morning, guys. So today we are going to discuss the cranial cavity. So it contains the brain and its surrounding meninges, portions of cranial nerves, arteries, veins and venous sinuses. So these are the very important points. These are the vertex, which is the highest points on the sagittal suture. Number 1 is the bregma. It is the meeting point between the coronal and the sagittal sutures. This is bregma. Lambda. It is the meeting point between the sagittal and the lambdoid suture. This is the lambda suture. Can you see this? This is the lambda suture. This is the bregma suture. Oblivion. It is the point on the sagittal suture between the two parietal foramen. Pterion. Pterion. It is the area in the temporal fossa where four bones, that is the frontal, parietal, temporal and sphenoid, join to form an H-shaped suture. See, this is the pterion. It forms the H-shaped suture. Can you see this? It is pterion. So the anterior branch of the middle meningeal artery, middle meningeal vein and the lateral sulcus of cerebral hemisphere lies deep to the pterion. Astrium. After pterion, the astrium, it is the meeting point of parietomastoid, occipitomastoid and the lambdoid sutures. This is astrium. This portion. Inion. Most prominent point on the external occipital protuberance. This point is inion. Stephanion. The point where the upper temporal lines cut the coronal suture. So the point where the upper temporal line cut the coronal suture. So coronal suture, these are present between the frontal bone and the two parietal bone. The sagittal suture present between the two parietal lobe. This is the sagittal suture. It is present between the two parietal lobe. These are the parietal lobe. Lambdoid suture, it is present between the, this is your lambdoid suture. This is your lambdoid suture. These sutures are present between the occipital bone and the parietal bone. Metopic suture, these separate the two halves of the frontal bone and present only in 3 to 8% of individuals. Somewhere anterior to the frontal bone. Coming on to the scaphocephaly, that is the boat-shaped skull due to premature union of sagittal suture. This is the scaphocephaly. It is the boat-shaped skull due to the premature union of the sagittal suture. Coming on to the oxycephaly, it is the pointed skull due to premature union of the coronal suture. Next is the piezocephaly. In this, it is the twisted skull due to an asymmetrical union of the suture. This is the plagioccephaly. It is the Can you see this? It is the asymmetric union. It is the asymmetric union of the sutures. Trigonocephaly, it is the triangular prominence of the forehead due to the premature fusion of the metopic suture. Can you see this? It is the triangular shape of head. Brachycephaly, it is short and broad skull seen in the cleidocranial dysostosis, seen in the Down syndrome, seen in the achondroplasia. So, seen in the cleidocranial dysostosis, Down syndrome and achondroplasia. The brachycephaly, the short and the broad head, while the dolichocephalic, it is the long and the thin head, thin skull, and it is seen in the Marfan syndrome. And the anencephaly, it is the vault of the skull not developed, resulting in the absence of the major portion of the brain, skull and the scalp. Do remember these points. This is the normal shape of the skull. This is the boat shape. This is the asymmetrical fusion of the sutures. This is the brachycephaly, which is broad and short. This is the trigonocephaly, which is triangular in shape. Now coming on to the vault of the skull, the internal surface of the vault shows the coronal, sagittal and the lambdoid suture. So these are your lambdoid suture, these are your coronal sutures, and these are your sagittal sutures. So in the midline, there is a shallow sagittal suture which lodges the superior sagittal sinus. This is the midline, and it's a shallow sagittal groove. So on the each side, you can see the small granular pit on the either side of the skull. And there are several grooves present on the anterior and the posterior branch of the middle meningeal artery, and the grooves in the middle meningeal artery. So in this you have a shallow sagittal groove, which is known as groove for superior sagittal groove. You have the granular pits, you have your grooves for the anterior branch and grooves for the middle meningeal artery. It is the anterior branch, it is the middle meningeal artery. So base of the skull. The skull is divided into three parts: the anterior cranial fossa, the middle cranial fossa and the posterior cranial fossa. So you have the foramen magnum over here. So the interior of the base of the skull is divided into, as I've already told you, the anterior cranial fossa is separated with the middle cranial fossa by the lesser wing of sphenoid. Whereas your middle cranial fossa and posterior cranial fossa, these are separated with the petrous ridge of the temporal bone. So in your anterior cranial fossa, you have the frontal and the ethmoidal bone, and in your middle cranial fossa, you have the sphenoidal bone. In your posterior cranial fossa, you have temporal bone, parietal bone, and the occipital bone. So in the frontal bone, you have, this is the groove for the superior sagittal sinus. This is the frontal crest, and this is your groove for the anterior meningeal vessels, and this is your foramen cecum. This is your foramen cecum. This is your crista galli. This is your cribriform plate, and this is your superior surface of orbital part. Coming on to the ethmoidal, as I've already told you, the crista galli, it is diamond shaped. Crista galli is always diamond shaped, and this is your cribriform plate. Coming on to the middle cranial fossa, in this you have your lesser wing of sphenoid, and this is your anterior clinoid fossa. This is your greater wing of sphenoid, in which you have the grooves of the middle meningeal vessels. In the body, you have the jugum and the sella turcica. In this you have the sella turcica, which contain tuberculum sella, and your hypophyseal fossa. and this one is your dorsum sella. So this is this one is your clavus. So coming on to the temporal bone, you have the squamous part, petrous part. So the petrous part, in this you have the groove for the lesser petrosal nerve. This is your groove for the greater petrosal nerve, and this is your arcuate eminence, and this particular point is your trigeminal impression. Okay, and this is your groove for your sigmoid sinus. So in your parietal bone, you have your branches of the middle meningeal artery and your mastoid angle. This is your mastoid angle, and your posterior cranial fossa is a very large part. So it covers only the occipital part, the base of your skull, you can say. This is your clavus, and it also contains the groove for the petrosal sinus, this one, and condyle. It is around the foramen magnum. All the points are around the foramen magnum. This is your sagittal sinus. This is your internal occipital protuberance. This is your internal occipital crest. This is your groove for the occipital sinus, and this is your groove for the transverse sinus. See, this is the groove for your transverse sinus. This is the groove for your occipital sinus, and as I've told you, this is your groove for the transverse sinus, and this is your condyle. Please go through it once. Starting with the anterior cranial fossa. So it lodges the frontal lobe of the cerebral hemisphere. Anteriorly, it is the inner surface of the frontal bone, and in the midline, it is a frontal crest, that attachment of the phalanx cerebri. So anteriorly and posteriorly, it has the lesser wing of sphenoid, and it is having your anterior clinoid process, in which your tentorium cerebri is attached, which gives attachment to your this gives attachment to your tentorium cerebelli. So you have to keep in mind there are two surfaces. The anterior surfaces, which is the inner surface of your frontal bone, it consists of your frontal crest, and your posterior part, it is in the lesser wing of sphenoid. This portion is the medial end of the lesser wing of the sphenoid. It forms an anterior clinoid process over here, and on each side, which gives attachment to your this tentorium cerebelli. See, your lesser wing of sphenoid, it articulates laterally. Lesser wing of sphenoid, it articulates laterally with the frontal bone and meet the anterior-inferior angle in the parietal. This is the parietal bone. So the median part of the anterior cranial fossa is limited posteriorly by the groove of the optic chiasma. The floor of the fossa is formed by the orbital plate of the frontal bone laterally, and by the cribriform plate. These are the cribriform plate of the ethmoid medially. So basically the floor is formed by the ridge of the orbital plates of the frontal bone laterally, and by the cribriform, these are your cribriform plates of the ethmoidal medially. So you have to keep in mind that the floor is formed medially with your cribriform plate and laterally with your orbital plates. So the crista galli, this is the crista galli, this is diamond shape. It is the sharp, this particular point, this is the diamond shape. The crista galli is the sharp upward projection of the ethmoid bone in the midline and for the attachment of your phalanx cerebri. Okay, so alongside of the crista there is a narrow slit. Can you see this, the narrow slit? These are your cribriform plate, and the upper surface of the cribriform plate, it supports the olfactory bulb. The upper part of it supports the olfactory bulb, and the small perforation of the cribriform plate are for the olfactory nerves. There is a small perforation, see, there is a small perforation in the cribriform plate. So these are basically for your olfactory nerves. So the fracture of the anterior cranial fossa may cause the bleeding and the discharge of the cerebrospinal fluid through the nose. It may also cause a condition that we call the black eye, which is produced by the seepage of the blood into the eyelid, as a frontalis muscle has no bony origin. Very important. Coming on to the middle cranial fossa, this is your middle cranial fossa. So in this, the medial part is formed by the body of the sphenoid, the greater or the lesser or the greater wing of sphenoid. So anteriorly it is it is covered, or you can say it is formed anteriorly by the lesser wing of sphenoid. Posteriorly the petrous part of the temporal bone, and laterally the greater wings of sphenoid bone and the parietal bone. So the floor of the each lateral part of the middle cranial fossa of the greater wing of sphenoid bone, and the squamous part of the petrous temporal bone. So you have to keep this in mind, that anteriorly the middle cranial fossa is formed of the lesser wing of sphenoid, posteriorly by the petrous part of the temporal bone, see, I'll make you clear in this. Anteriorly it is formed by the lesser wing of sphenoid, posteriorly it is formed by the petrous part of the temporal bone. Posteriorly, anteriorly by lesser wing of sphenoid, posteriorly by your petrous part of the temporal bone, and laterally formed by the greater wing of sphenoid. So the body of the sphenoid contains the sphenoid air sinuses, which are lined with the mucous membrane and communicate with the nasal cavity. They serve as the voice resonators anteriorly. It is somehow resemble like a bat. So this is the optic canal, which transmits the optic nerve and the ophthalmic artery. So the superior orbital fissure, which is an opening between the lesser and the greater wing of sphenoid. The sphenoparietal venous sinus, this is the sphenoparietal venous sinus. It runs medially along the posterior border of the lesser wing of sphenoid and drains into the cavernous sinus. I repeat, the sphenoparietal sinus, it runs medially along the posterior border of the lesser wing of sphenoid and drain into the cavernous sinus. So it has the foramen rotundum, the foramen ovale, and the foramen spinosum. This is the foramen rotundum. In this particular point, it is situated behind the medial end of the superior orbital fissure and perforates the greater wing of sphenoid and its function is it transmit the maxillary nerve from the trigeminal ganglion to the pterygopalatine fossa. Very important function, that it transmit maxillary nerve from the trigeminal ganglion to the pterygopalatine fossa. Please write it down because it is very important. The function of each foramen is very important. Coming on to the foramen ovale, this is the foramen ovale, which is lies posterior lateral to the foramen rotundum. It is lies posterior lateral to the foramen rotundum. It perforates the greater wing of sphenoid and transmits the large sensory root and small motor root of the mandibular nerve to the infratemporal fossa. So the lesser petrosal nerve also passes through it. Coming on to the foramen spinosum, this is the foramen spinosum. It lies posterior lateral to the foramen ovale. It lies posterior lateral to the foramen ovale, and it transmits the middle meningeal artery from the infratemporal fossa into the cranial cavity. Very important. So the function of the foramen rotundum is to transmit the maxillary nerve from the trigeminal ganglion to the pterygopalatine fossa. Foramen ovale, it transmits the large sensory root and the small motor roots of the mandibular nerve to the infratemporal fossa. And foramen spinosum, it transmits the middle meningeal artery from the infratemporal fossa into the cranial cavity. So foramen lacerum, it lies at the apex of the petrous part of the temporal bone and the sphenoid and the occipital bone. This is the foramen lacerum. This one is the foramen lacerum. So the inferior opening of the foramen lacerum is filled by the cartilage and the fibrous tissue. Very important. The small blood vessel passes through this tissue from the cranial cavity to the neck. So carotid canal opens into the side of the foramen lacerum above the closed inferior opening. So this is your trigeminal fossa. Lateral to the foramen lacerum is an impression of the apex of the petrous part of the temporal bone for the trigeminal ganglion. This is the trigeminal fossa. This is the clevis, this is the foramen magnum, this is the internal acoustic. So on the anterior surface of the petrous bone there are two grooves. This is the lesser petrosal groove and the greater petrosal groove. You have to keep this in mind. So the largest medial groove is for the greater petrosal nerve, this one, and a branch of facial nerve. It is the smaller is the lesser petrosal nerve. So there are two grooves for the nerves. The largest one is the greater petrosal nerve. The smallest one is the lesser petrosal groove. So in this, the greater petrosal nerve, it enters through the foramen cecum over here and deep to trigeminal ganglion and joins the deep petrosal nerve to form the pterygoid canal. This is the pterygoid canal. I repeat, the greater petrosal nerve, it enters through the foramen lacerum, very important, deep to the trigeminal ganglion and join to the deep petrosal nerve to form the nerve of the pterygoid canal. So the lesser petrosal nerve passes through foramen ovale. So abducent nerve bends sharply forward across the apex of the petrous bone medial to the trigeminal ganglion. Here it leaves the posterior cranial fossa and enters into the cavernous sinus. See, this is your abducent nerve. It is the sharply bent across, you can say it is the nerve which bends sharply forward the apex of the petrous bone and medially, and it enters into the cavernous, finally it enters into the cavernous sinus. Here it leaves the posterior cranial fossa and enter into the cavernous sinus. So the arcuate eminence is the rounded eminence. This is the arcuate eminence. This is the round eminence found in the anterior surface of the petrous bone and is called the underlying superior semicircular canal. This is the tegmen tympani. It is a thin plate of the bone. It is a forward extension of the petrous part of the temporal bone and it adjoins the squamous part of the bone, the tegmen tympani. There was a question in your AIMS exam about the tegmen tympani. So we have discussed this earlier also. The median part of the middle cranial fossa. See, this is your sella turcica, and the deepest part is known as the hypophyseal fossa, in which your pituitary gland lodges, and posterior to the your sella turcica there is a square shaped bone which is known as dorsum sella, which gives attachment to the fixed margin of the tentorium cerebelli. I repeat, this is your sella turcica, the sella turcica, and you can see the concavity and the convexity. The deepest portion of the sella turcica, it is known as the hypophyseal fossa, which lodges the pituitary gland, and posterior to the sella turcica we have the square shaped plate of the bone which is known as the dorsum sella, and the dorsum sella it has the two tubercles which is called the posterior clinoid process. It has the two tubercles which is known as the posterior clinoid processes. What is the function of posterior clinoid processes? It gives attachment to the fixed margin of the tentorium cerebelli. So the depression is known as the this is your sella turcica. The depression is known as the hypophyseal fossa, which lodges the pituitary gland, and the posterior part of the sella turcica we have a square plate which is known as your dorsum sella. So in your dorsum sella you have the two tubercles which is known as your posterior clinoid fossa. Your function of the posterior clinoid fossa is to give attachment to the fixed margin of the tentorium cerebelli. Now coming on to the posterior cranial fossa, this is your anterior cranial fossa, this is your middle cranial fossa, and this is your posterior cranial fossa. It is along the foramen magnum. Anteriorly it is bound superiorly by the petrous part of the temporal bone. Posteriorly it is bound by the internal surface of the squamous part of the occipital bone, and the floor is formed by the basilar condyle and the squamous part of the occipital and the mastoid part of the temporal bone, and roof is formed with your tentorium cerebelli. This is the roof. So The foramen magnum transmit medulla oblongata, ascending spinal parts of the accessory nerves, and the two vertebral arteries. Hypoglossal canal is situated above the anterolateral boundary of the foramen magnum, and it transferred the hypoglossal nerve. So your hypoglossal canal, it is situated above the anterolateral boundary of the foramen magnum, and it transmits the hypoglossal nerve. Very important. So this is your jugular foramen. The jugular foramen, it is lies between the lower border of the petrous part of the temporal bone and condylar part of your occipital bone, and it transmits your inferior petrosal sinus, 9th, 10th and 11th cranial nerve, and the sigmoid sinus. Very important, very important. It was there in your AIPG exam. So the inferior petrosals, so the internal acoustic meatus. This is the internal acoustic meatus. It pierces the posterior surface of the petrous part of the temporal bone, and it transmits the vestibulocochlear nerve and the motor and the sensory roots of facial nerve. Very important that the medulla oblongata, it ascending spinal parts of the accessory nerves. You have your hypoglossal canal, which is situated in the anterolateral boundary of the foramen magnum. It transmits the hypoglossal nerve. Second, you have the jugular foramen. It is lies between the lower border of the petrous of the temporal bone and the condylar part of your occipital bone, and it transmits your inferior petrosal sinus, 9th, 10th and 11th cranial nerve, and the sigmoid sinus. And your internal, this is your internal acoustic meatus. Internal acoustic meatus, this pierces the posterior surface of the petrous part of the temporal bone, and it transmits vestibulocochlear nerve and motor and the sensory roots of the facial nerve. Very important for your exam point of view. So the superior petrosal sinus, these run backward along the upper border of the petrous sinus of the narrow grooves, and it drains into the sigmoid sinus. So it runs your superior petrosal sinus. This is your superior petrosal sinus. It runs backward along the upper border of the petrous bone, and it drains into the sigmoid sinus. So the sigmoid sinus, it descends to the jugular foramen, and it deeply grooves the back of the petrous bone and mastoid part of the temporal bone. Here it lies directly posterior to the mastoid antrum. This is the temporal bone. This is your superior petrosal groove, and this is your sigmoid groove. See, this is your superior petrosal sinus. This is your superior petrosal sinus. So it runs backward. This is your superior petrosal sinus. It runs backwards along the upper border of your petrous bone, and it drains into the superior petrosal sinus. It drains into the sigmoid sinus. The sigmoid sinus. And next is sigmoid sinus descends to the jugular foramen, and it directly descends to the jugular foramen. It deeply grooves the back of the petrous bone and mastoid part of the temporal bone. Here it lies directly posterior to the mastoid antrum. Coming on to the neonatal skull. So disproportionately large cranium relative to the face. In childhood, the growth of the mandible, the maxillary sinuses and the alveolar processes of the maxilla results in the great increase in the length of the face. The skull is smooth and unilaminar. No diplo is present. Most of the skull bone are ossified at the birth, but the process is incomplete and the bones are mobile on each other, being connected by the fibrous tissue or the cartilage. The bones of the vault are ossified at the membrane. The bones of the base are ossified in the cartilage. Very important line, that the bone of the vault are ossified in the membrane and the bones of the base are ossified in the cartilage. Very important. The bones of the vault are separated by the unossified membranous intervals that are called frontanelles, or you can say frontanelles. So the anterior frontanelle is the diamond shape. This is your anterior frontanelle. This is the diamond shape and lies between the two halves of the parietal bone and the two half of it. It lies in the two half of the parietal bone and the frontal bone. So the fibromembranous forming the floor of the anterior frontanelle is replaced by the bone and is closed by 18 months of age. Very important for your exam point of view. So the posterior frontanelle is your triangular in shape. Anterior is diamond in shape and posterior is triangular in shape, and it lies between the parietal bone and the parietal bone and the occipital bone. And the anterior frontanelle, it lies between the two parietal bone and the frontal bone. So it lies between the two parietal bone in front and the occipital bone behind. By the end of the first year, the frontanelle is usually closed and can no longer be palpated. So coming on to the tympanic part. So the tympanic part of the temporal bone is merely a C shape, a tympanic kind of a tympanic ring, and in the adult it is C shape, not so prominent. This means the external auditory meatus is mostly entirely cartilaginous in newborn and tympanic membrane is nearer the surface. So in the newborn, the auditory meatus is almost entirely cartilaginous in nature. Although the tympanic membrane is nearly as large as in adult, it faces more inferiorly. In adult, it faces more inferiorly. During childhood, the tympanic plate grows laterally, forming the bony part of the meatus, and tympanic membrane comes to face more directly laterally. So in this, the tympanic membrane is laterally, and in the adult, the tympanic membrane faces more inferiorly. So the mastoid process is not present at birth and develops later in response to the pull of the sternocleidomastoid muscle when the child moves his or her head. It was there in your AIPG exam. Important question. Coming on to the mandible has the right and the left half at the birth, united with the midline. As you know, the two halves fuse with the symphysis during the end of the first year. And in the children, in the At the time of the birth, the angle is more obtuse. With the presence of, or with the eruption of the dentition, the angle gets acute. So the angle of the mandible at the birth is obtuse, the head being placed level at the upper margin of the body and the coronoid process. It is only after the eruption of the permanent teeth the angle of the mandible assumes the adult shape, and the head and the neck grows so that the head comes to lie higher than the coronoid process. See, at birth there is high coronoid process, but in the adults the neck is higher than that of the coronoid process. So these are the types of the bone: the sesamoid bones, the pneumatic bones, and the membranous or the dermal bones. The sesamoid bones are the patella, pisiform, and the fibula, and pneumatic bones, some cranial bones having the air-filled cavities for making the skull lightweight, resonance of voice, and air conditioning. These are ethmoid, maxilla, sphenoid, frontal, and mastoid. Membranous or the dermal bone, the skull vault bones, and the facial bones. So this is all about the cranial cavity. Please go through it once. Thank you.